So I'm not sure if you've heard about this concept of the golden hour. I personally don't like that language. I don't like talking about the golden hour because, as I mentioned in the last video, birth is something that we can't really prepare for exactly. Like, we just don't know how it's going to go. We can prepare for variables, but we don't really know exactly with certainty what will happen in our birth. So this really applies to what happens after birth. And as I just said, I've had lots of experience with families after birth when they don't get to be with their newborn straight away because, let's say, they might have had birth intervention where maybe baby needed a little bit of help to breathe after birth, and they might not have had this golden hour that is so emphasized in our society. Of course, it's the gold standard to have immediate skin to skin with your baby. And I think it's important to just highlight that things don't always go as we expect. And so aiming for that first, skin to skin with you is really important. And I love to suggest for my pregnant clients that they nominate somebody in case they can't have skin to skin. There are instances of a postpartum bleed, or perhaps you're feeling unwell after birth and you need medical attention, for example. This would be a reason that maybe you don't feel up for skin to skin. And as your baby adapts to the world, they will really benefit from skin to skin. So you can nominate your partner in your birth plan, or maybe a grandparent or a close friend who will be with you to have skin to skin in your absence if you can't do this. And really, I just want to highlight that when we have an idea on kind of what some of these variables are, then we can really get ready for what happens next.